Hey everyone, it's Marie Hopkinson. Welcome back to the Chinese Medicine Podcast. I want to do a video today answering a subscriber's question. What's the difference between Western medicine and Chinese medicine? Well, there's a lot I could say on this, and strap in your safety belts because it could be a long ride. No, I'll try to make this a short video. There's a lot of differences in the system. I want to talk about a few key differences. And one of the differences is that we make our own diagnosis. So firstly, from a very, very, very broad perspective, Western medicine is like looking at the body from one particular way. And Chinese medicine is looking at the body from another particular way. So they are completely different systems. Now, there are some natural medicine systems that look at the body from the Western medicine way, but they just use natural methods to do that. So let's say a patient has something like diabetes. If you're a naturopath, you're going to try to use natural ways to treat the diabetes, but you're still understanding the diabetes from a Western medicine perspective, right? So you're not sort of, you do have to ask the patient questions about individual things. And yes, the approach can be somewhat individualized, but there's often these things like, okay, what's natural ways to, control the blood sugar problem, however that plays out for that person. Or thyroid is a good example as well, like natural ways to increase your thyroid. Like a person might be low in their thyroid hormones, and so that then they've got a slow metabolism. A Western medicine based natural therapist, so like a naturopath or a nutritionist, is going to look at natural ways like using foods or vitamins or supplements or even herbal medicine things. So even things like Chinese herbs that I've got behind me here, they would think of, this has these properties to naturally do what Western medicine is trying to do. Whereas with Chinese medicine, it's a totally different way of thinking. We don't have those diagnoses. We don't have those ways of thinking. Now, do we just ignore that? Not really. But a true practitioner, like as in a person who's sticking to the fundamentals, or particularly like we have this differentiation now in Chinese medicine of classical Chinese medicine and traditional Chinese medicine, and they both sound like very similar things. But classical Chinese medicine means adhering to the Han Dynasty practices, so the ways in which the formulas were prepared in that time and the dosages and the way that Chinese medicine was intended to be practiced. Even some people who do traditional Chinese medicine are still adhering to that way. But it has crept into Chinese medicine over the years, and this modernization of it, where some people do use it like that, or they start to think like that. Now, I always caution my students against that, because it's kind of like dipping your feet in the forbidden pool of, not that it's wrong, but it's not Chinese medicine. It's not proper practice of Chinese medicine to go, this herb is antibacterial, or this herb is antiviral. That's a different way of thinking about it. So it's nice when the herbs have those properties, even acupuncture points. So we might think of like these points, like there might have been research on a particular point that helps increase particular hormones. In Chinese medicine, it's still necessary for us to treat a patient with the due diligence that it takes to make the Chinese medicine diagnosis and then give them the prescription according to that. Now, quite often there's an overlap between that. I always find that really cool, and I'm like, this is great, because it validates what we already know, right? And it's nice, it's cool, and it's really interesting to think that, hey, the people in the Han Dynasty that created this stuff actually knew more than they could prove. We can prove kind of how it works now, and that's how I find it cool. But it doesn't make me go, let me change my practice, right? I still adhere to the traditional ways of doing things. And that brings me to the methods of diagnosis. So the method of diagnosis for Chinese medicine primarily should be pulse diagnosis. Another way of diagnosis in Chinese medicine that's unique is the tongue diagnosis. So thinking of like the map of your body on the tongue, and almost like, yes, the map of your body on your wrist, which is your pulse. So these three different positions relate to different organ systems in different parts of your body. And that's a way of a practitioner being able to tell what's going on with that patient. Like now, it's like, okay, what does that patient need treated now? And it is a layered approach of a process. So Like, for instance, if I had a patient that come in and said, oh, look, I want to have a baby, coming in for fertility treatment, and they're like, I've got a cough, and they're just like, oh, just ignore that old cold and flu that happened to me yesterday. It's nothing to do with the fertility. I just want my fertility treatment. And let's say we know from their diagnosis or their situation, you're pretty sure they need tonification as part of their let's say they haven't had their period for like 3 months or something, and they probably need tonification. We can't just give them that tonification treatment while they've got the cold and flu, because it's actually sort of an opposite thing, and it would be reckless of a practitioner to do so. It would make the patient would feel really uncomfortable, not feel good. With acupuncture, they're less likely to get these flare-ups or feel worse or, not feel good. But is it really doing anything? Is it doing, can the body kind of do that when it needs to do something else? So there's this idea that acupuncture and herbs can kind of, we have to use them. It's very hard to go against nature. It's very hard to go against what naturally should be happening in many ways. There's lots of applications of that in practice. So like to induce a baby when it's not really ready to come out yet. This is very, very popular in China because it's very auspicious to have babies around certain times of the year, because especially end of Chinese New Year or the new Chinese New Year, there might be a certain time people want to have their baby because it's more lucky to have it, or auspicious to kind of have it in a certain time. And yeah, acupuncture is used to kind of bring on the labor earlier than it should be, maybe. And it's hard to do that. If it's not meant to be the time. I'm not talking about making it come out prematurely, but maybe a week early than it should be or something like that. It's not like a button that you press and something can happen. So that's a big difference in Chinese medicine, is we have to go with what nature intended. We have to go with the seasons. We have to go with the body's going to naturally want to go with those things. And so we kind of want to go with that. To go against that is very difficult. So it's hard to do something like that Western medicine sort of proposes to do, where they're like, let us artificially, well, it is very artificial, induce a situation in your body that normally couldn't be there. You want to change the hormones of a person. Chinese medicine wouldn't be able to kind of do that, as in, the pill is a good example. It tricks a person into thinking not a person, but it tricks the body into thinking it's pregnant. There's no artificial way to do that with acupuncture because it's so unnatural. It's such an unnatural situation to be in. So those kinds of things, they're the kind of wonders of modern medicine, wonders of Western medicine, but not possible to do those things with Chinese medicine. The second thing that Chinese medicine is really big on treating or thinking about in the treatment process is functional raising, right? So increasing your body's ability to face what's going on, whatever is going on, is a key aspect of it. And making your body as strong as it possibly can so that it can fight what's going on, and raising its function or maintaining its function or keeping its function going well. Now, by function, we think about that as yang or qi, right? So in acupuncture, they often talk about it as qi, the force that flows within the acupuncture vessels. In classical herbal medicine, we often think about that as yang, just because we simply only have really yin and yang. So yin is the structure and the body, and the structure in which the function kind of sits on. A person could have a pancreas, going back to the diabetes example, they still have the yin. There's nothing wrong with the yin. The structure is there, but why isn't it working how it should be working? Its function isn't working properly. So it's a yang issue. It's a functional issue. And if that continues on, that functional issue continues on for a long time, then it eventually affects the structure. It's the same as when you have a car. I often use this example, if you're driving your car and you run out of petrol, it's just a functional issue. All I need to do is put petrol in my car and my car will be going again. But if I continuously put the wrong fuel in my car and it's not running properly, especially if you have one of these sensitive cars where you put the wrong petrol, it can detect, oh no, you haven't put premium in here. And next thing you know, your engine light's coming on and then your car's not running properly. if you keep doing that regularly, it will deteriorate your engine or your car, or let's say you have something wrong in your car over time. Or if I run out of petrol and I leave my car on the side of the road and then I come back for it a year later, it might be rusty because it hasn't been moved. Now, I don't think people are leaving their bodies on the side of the road and getting rusty, but this is a general principle of acupuncture and Chinese medicine, that we want to think about function raising, not just symptom treating. Now, we do symptom treating in some situations. That's all that we do, right? So, for instance, if I had a patient that came in extreme pain, I would be thinking more about how can I reduce this pain, because that's something acupuncture is very good at doing. And that might be a symptom treating. Now, in the process of treating it, it is accessing what the body already has there. I'm not giving them a painkiller that's like now it's a drug that they have to metabolize and deal with. That's a different thing to sticking acupuncture needles in. And, the body already has those pain-relieving chemicals within it, and that's what you're accessing with acupuncture. And maybe healing processes that naturally are going to take place. And then if the body heals itself, then the pain will go down. And that's a good thing, and that's a more natural way to think about stopping pain. But, in Western medicine, it's almost like this stopgap thing a lot of the time. Like, they don't seem to really, like on the practitioner level, and I'm not sure if even medicine is, whether it's because of drug companies and the influence there and where the money is and the resource is, it doesn't seem to bother doctors that people have diabetes. They're not sort of sitting there thinking, we need to stop all these people getting diabetes. They're just like, if a patient comes in with diabetes, we give them this treatment and we give them we make sure they have the insulin, and then they can get on with their lives and live their lives. They're not sort of thinking, why has their pancreas stopped working? We better try to fix or make their pancreas work again. Can it work again? I'm not saying we can, because if they did that, then you wouldn't need all this insulin treatment. And I don't know why I've used that as an example, but I think it's an example people can relate to, because it's a disease and illness that people know about. Now, sometimes it's not possible to do that, right? Like if it was possible, then possibly you could think, well, we would have already come up with it. But because we're not sitting there with our resource, all those doctors, sitting there thinking, hey, that's what we should be doing. It's frustrated me in the past when I've been younger, when I kind of first started doing Chinese medicine, and I would go to a Western medicine doctor for something, and in my naivety, possibly because I've always studied Chinese medicine, like since I was 17 is when I started learning it, I just thought you should be thinking about this isn't a solution to give me a drug to stop this problem or to treat this problem, right? The solution should be something more, you should be looking at the cause of it. Shouldn't you be looking at the cause? Shouldn't we be, I wouldn't want my body to be on this medication all this time. That's not something that I would want to be a part of my life. Even at 17 or 18, I kind of knew that. So that's not a solution for me, right? That's what I was thinking. And I guess I don't hang out with a lot of medical doctors all the time. And I know there's some good ones out there that do think like that. But the system of Western medicine doesn't support them in thinking like that, in practicing like that. So even if they wanted to help a person's pancreas work again, how could they do that? Even if they wanted to think about, when we think about treating cancer, I wonder why we don't think about, let's try to how could we make the body so strong that it repels the cancer? That's the kind of thinking that Chinese medicine has. Now, the other thing that's really hard when I do these kinds of videos is, I'm not trying to make a claim that Chinese medicine can do something, because in Australia, we have really a lot of regulations about what we can say about things that might be insinuated as a claim. So I'm not claiming that Chinese medicine can treat these diseases like cancer or diabetes. That's not what I'm saying. I'm just saying in the concept of thinking about an illness like that, that's the kind of thinking that Chinese medicine has. Now, third thing that's really different about it is we don't use those diagnosis labels to treat people and have formulas associated with it. So I don't have diabetes formulas where I'll go, oh, here's my 5 diabetes formulas, I'll pick one of these. If a person had poor, the thyroid issue is probably a good one. So let's say they came in, they said, oh, I've had a blood test, my thyroid's low, I want to try to do something about that naturally before I, go down the road of Western medicine. So I would check their pulse, I would ask them questions, and we would work out in the consultation what's the cause of the problem. In Chinese medicine, so they might have a pattern like liver qi stagnation, or spleen qi deficiency, or spleen yang deficiency, or we might even think about it from a different perspective. If I was thinking about it from a classical Chinese medicine perspective, it might be like a tai yin, which is the spleen and a lung system, like the earth and the metal. There might be some kind of water metabolism dysfunction there. In TCM, they often think of things like kidney deficiency. Anyway, there's all these different patterns of disharmony that could be part of it. And quite often with someone like a thyroid problem, they could be multifaceted things. So some things could be causing them to have water overflowing and water not being metabolized properly. So they get all puffy and bloated, or, just fluid metabolism, kind of puffy in the face. And anyway, other things. And so then I would go to my herbs and think, what formula will treat this water metabolism problem, if that was the issue? What formula would raise up their yang so that their body gets so strong that it flushes, it transforms the excess water that's there, or helps that wood to function properly. Often with thyroid problems, there can be a dysfunction of wood, wood's not moving, the movement of wood isn't doing its job, so that there's a sluggishness. So how do we get wood moving? We literally have to sometimes put the wood on the fire, and that's the herb of cinnamon. Sometimes we use that. We might use acupuncture to do that. So we might use the liver channel, or the spleen, or the kidney channel, or different points on those things, or the gallbladder channel, depending on what's going on, right? So that's a very big difference in how we think about things. Now, Western medicine's very good at treating some things that Chinese medicine can't really do anything about, and some of those things might be surgical things. In the past, in the Han Dynasty, yes, there were surgical interventions with acupuncture. We don't really do those anymore. Bone setting issues, where people have a fracture. Yes, there are fields of Chinese medicine that deal with that, but not in Australia. As in, we that's out of our scope of practice here, but in some Asian countries, that's still a part of what's done. If someone had a traumatic injury to their body and they cut off their arm, if that happened to me, if I was out in the garden and I sawed off my arm somehow, I would be going to Western medicine. I wouldn't be trying to use herbs to stick my arm back on, right? That would be reckless and silly, because Chinese medicine can't do that. So there's some things where Western medicine's really, really good at, but I think with these chronic illnesses, sometimes it can be necessary to use Western medicine in preference of Chinese medicine, even when the condition, the person's waited so long to treat the condition and they're in so much pain, and leaving things untreated for any longer might result in such further deficit or deficiency or detriment to their body. One of the big parts of Chinese medicine that we think about, with big principles of Chinese medicine, is the longer you wait to treat something, the longer it takes to treat it, and also the more detriment that happens to you. Sometimes a swift treatment that just comes in and there is some detriment to that swift treatment is actually better, and then you can deal with the fallout of using that swift treatment afterwards. So let's say antibiotics is a good example. When do you intervene with antibiotics if you've tried so hard with Chinese herbs? You might not have intervened with the herbs quick enough, or the dose might not have been strong enough, or the herbal formula might have been wrong. And this has happened to me several times in my life, where I've tried to avoid antibiotics, and sometimes I've avoided it and sometimes I haven't. One of the times I couldn't avoid it was I had a tooth abscess, and it had kind of escalated to the crazy pain when I'd gone on a flight, and I got off the plane and I immediately took Chinese herbs. It wasn't painful before. It was sort of a little bit niggly here or there, but something had happened when I got on the flight. Lucky it was the flight home, not the flight there. I was actually coming back from a conference, like a Chinese medicine conference thing. And so I got home, I think it was a Sunday. I called up the dentist and was able to get an appointment for the next day. And they gave me antibiotics. And I've been taking the herbs for 2 days. Now, sometimes you're in such a state of pain, you can't even prescribe the herbs to yourself. Like, you know, that can happen to practitioners too. You can just become so unwell. Anyway, I took the herbs and it wasn't helping. The pain was getting worse and worse. And I had this script for antibiotics, and I had a script for Panadine Forte, which is like a high codeine based prescription medicine. And I had that in my bag on the way home from the dentist, and I was thinking, I don't really want to get this filled. Like, I won't take it. I'll be fine. I'll just, you know, because they actually couldn't take the tooth had to come out, but they couldn't take it out until a week. And I was at the point where I was kind of like vomiting from even taking the herbs. The pain was so bad, and I just ended up having to take the antibiotics. And at that point, you have to be a bit sensible sometimes. Even for me, like, that would be extreme. Like, I'll try to use Chinese medicine every time as best as I can. And yeah, like, sometimes you've just got to do it. And so, yeah, the antibiotics are going to have a detriment on your body. So then you have to deal with that fallout after. So after that tooth had come out, then I was like, okay, so now I need to look after my spleen and stomach more than before. You know, now I need to do, you know, I can't remember exactly what I did. I probably did some bone broths or something like that as part of, you know, taking some herbs as well afterwards to treat that. So what I'm getting at is, you know, I'm an extreme example. Most patients would just go for the antibiotics. They wouldn't be messing about. And like, I really felt the difference taking those antibiotics. The pain, that it definitely helped it. Like, you know, and this is, you know, and including taking the Panadine Forte. The Panadine Forte wasn't cutting through the pain. But once I got on the antibiotics as well as the Panadine Forte, the pain had gone down, like, to the point where, like, I could bear it for a few days until I had to wait to get the tooth taken out. I don't know why I told you that story. I hope that it makes sense in the grand scheme of things. So that's a big difference in Western medicine to Chinese medicine. I think that's a good example, that story of following up, right? So I don't even know if Western medicine really thinks about that. They just they might give you a list of side effects that can happen from a drugs, but they don't really think about this idea of like, hey, this isn't my patient. I need to care for this person. Like, I have a responsibility to care for this person in terms of like, it's not just here, take this medicine and off you pop and I'll never see you again. Now, I do have patients like that because I can't go around to people's homes and make sure they're taking the herbs and check out everybody exactly, you know, like that. In a real, in a different world, I guess we would have more connection with people, or people would have a better accessibility, because there's obviously issues with accessing medicine about where it comes into like affordability, right? Money, people have to pay money to get it, and time and all that sort of stuff, right? But anyway, so I don't think Western medicine really thinks so much about that care. I'm not saying doctors don't care or GPs don't care. I'm sure that they do, and I'm sure that they want to, but the system doesn't have a plan for that. It doesn't really. I mean, they do for some conditions, like if you had diabetes, you'd have like some kind of care plan, and they would manage that. And there are some conditions where there's like, you know, you're going to have this lifelong thing, but they're not thinking, okay, you're going to take this drug that's going to really affect your liver and your kidneys, but it's going to help your arthritis, or it's going to help your, you know, problem that's going on. Now, how do we deal with the fallout of that medication on your system? They don't think about that. Like, how do we make your body stronger, or how do we use this for a period of time and then think about something else, or think about why have you got this problem and how can we prevent that from, you know, that preventative aspect of things getting worse is a big aspect of Chinese medicine. So I hope this video has been useful and helpful to you, and if it has, make sure you click the subscribe button and the notification bell, and you'll never miss an episode from me. I'm doing more videos and more. I'm doing courses as well on Chinese medicine. I've got a free personality test that you can get in the link below, and you can find out more about your Chinese medicine 5-element personality type, and that's one of the courses that I'm offering on demand as well. So you can learn about that, and you can learn about different things. So you can find all that in the description below the video. If you're on Spotify or Apple, please rate us on there. Really helps us to get found. Thank you so much for your support, and I'll see you again in another video soon.